Hi, I'm Rami Komrokji. I'm Vice Chair of Malignant Hematology Department at Moffitt Cancer Center. I'm here at ASCO 2023 meeting, and I'm excited to share some of our data presented at this meeting. Myelodysplastic syndrome is one of the most common myeloid neoplasms we deal with. Roughly, there is 50 to 60,000 cases per year in the United States. This disease impacts patient survival as well as quality of life. Anemia is the major problem that patients deal with, that unfortunately many of the patients become transfusion dependent. At Moffitt, we lead one of the largest programs worldwide, and we've been on the front of getting clinical trials for our patients for approval for new drugs. At this ASCO 2023, I'm excited to share some of the data we are presenting on two new drugs in lower risk myelodysplastic syndrome. The first one is a phase 3 randomized clinical trial called the eMERGE that I had the honor to be part of the steering committee and the senior author on this presentation. This is a phase 3 randomized clinical trial with a drug called imetelstat. It is a telomerase inhibitor that inhibits telomerase activity that's increased in malignant cells. In the phase 2, around 40% of the patients became transfusion independent, and the phase 3 indeed confirms this signal that this drug leads to transfusion independency in around 40% of the patients. Those are durable responses where patients may enjoy not needing blood transfusion for almost a year. Also, interestingly, we see a signal that it could be disease modifying by reducing the allele burden of selected mutations. Imetelstat did have activity in both patients with MDS ring sideroblast subset as well as non-ring sideroblast subset, and also among patients that are heavily transfusion dependent, that needs more than 6 units of blood on regular basis, which many of the other drugs unfortunately don't. Based on these results we are presenting at this meeting, we anticipate that this drug will be approved by the FDA, hopefully by next year, and available for our patients. We are also leading the extension study of this, assessing further safety of this drug. Thank you very much.